ALS.
What is ALS? ALS is amyotrophic lateral sclerosis, also known as Lou Gehrig's disease, after a famous baseball player who died of ALS. It is a rare neurological condition that affects motor neurons. In ALS, motor neurons degenerate and die, leading to a loss of communication between the brain and muscles. As a result, the muscles weaken, twitch, and waste away. Eventually, the brain loses its ability to initiate and control the voluntary movements.
Symptoms of ALS can vary, but they may include muscle twitches in the arm, leg, shoulder, or tongue, muscle cramps, tight and stiff muscles, muscle weakness, slurred speech, difficulty chewing or swallowing. While ALS doesn't affect the ability to taste, touch, smell, or hear, it gradually impairs the patient's motor functions, which in most cases is fatal. ALS is an irreversible and progressive disease. At present, scientists have not yet determined how or why the disease develops, and regrettably, there is no cure or treatment available.
As ALS continues to advance, the patient may need assistance to maintain their quality of life. Providing patients with compassionate care during these difficult times is of utmost importance. Palliative care plays a vital role in providing the necessary support and ensuring that patients receive the care they need. Let's explore the ways to support both the patient and their family during the later stages of ALS.
Individuals with ALS often experience challenges with standing, walking, and utilizing their hands and arms. To prevent joint pain and contractures, it's essential to encourage physical activity and exercise, which includes range of motion exercises. As the weakness in the limbs begin to impact mobility, safety, and independence in daily activities, it's crucial to refer patients to a physical therapist. It is necessary to promote proper positioning to prevent pressure injuries.
Patients with ALS may struggle with chewing and swallowing, a condition called dysphagia. To assist the patient, suggest consuming smaller, more frequent meals, easily consumable foods, and liquid supplements. Collaborate with dietitians to ensure patients receive proper nutrition and devise techniques to safeguard their airways during mealtimes.
Speaking of forming words becomes difficult for an individual with dysarthria. The common symptoms of ALS initiate the use of words, or letter words if the patients can use their arms. Speech therapists teach adaptive techniques and explore the alternative communications methods like smartphone apps, alphabet boards, or pen and paper.
Breathing becomes increasingly challenging for ALS patients, and many rely on ventilators. Maintain airway patency, use suctioning to prevent choking, and administer medications to reduce secretions. They also encourage deep breathing exercises, chest physiotherapy, and elevate the head of the bed to ease shortness of breath and to provide comfort during sleep.
Anxiety and depression can arise as ALS patients experience the progressive loss of function. Provide emotional support, creating an accepting environment for patients and their families to share concerns and fears. Anticipate care needs, help set realistic expectations, and may refer patients to ALS support groups for additional support.
ALS management requires an interprofessional approach. Healthcare professionals such as respiratory therapists, physical therapists, occupational therapists, and speech therapists all play vital roles in providing comprehensive care. They assist with breathing care, physical therapy, occupational therapy, speech therapy, nutritional support, and physiological and social support.
Coping with ALS is a personal journey, and there are key strategies to improve the quality of life for patients and their families. Finding purpose and meaning staying connected with others, prioritizing important relationships, building a support team, and taking good care of oneself are all essential aspects of this journey.
It is important to plan for the future when living with ALS, engaging in discussions about future medical care and exploring options like hospice care can bring peace of mind and alleviate anxieties for patients and their loved ones.
Getting involved in ALS research can offer hope for future treatments and a sense of purpose for individuals with ALS. Participating in registries and donating samples for research can help scientists better understand the disease and work towards finding effective therapies.
ALS may present significant challenges, but
With the support of healthcare professionals, family, and friends,
patients can lead meaningful lives
despite the limitations imposed by the disease.
By addressing physical, emotional, and social needs,
We can navigate the ALS journey
together.